For all your embroidery and digitizing needs, call Bees Embroidery.
Some are having this, what we call a hyperactive delirium, where you can get very agitated and you start to have these paranoid delusions. Some of them are having this thing called hypoactive, or where they have these like kind of internalized visions, and then they start to have this very bad confusion.
Dr. George says ICU delirium is not uncommon, especially in older patients and in people who have many medical problems. But research suggests COVID-19 delirium is trending younger. He adds that it's unusual because interventions that typically reduce delirium don't seem to help coronavirus patients much, and some patients are actually arriving at the hospital with complaints of delirium and hallucinations. Sedating medications given in the ICU to relax patients may contribute to delirium because they can have long-lasting effects on receptors in the brain. Doctors also suspect the disease itself may impact brain tissue and cause delirium, but more research is needed to be sure. And early studies suggest some COVID-19 delirium may be linked to prolonged periods of low oxygen in the brain.
The brain is not getting enough oxygen in some of these patients just because of the severe respiratory issues, and for an extended amount of time that can cause some of the individual brain cells to die, and over time that death of some of these brain cells could be permanent, and that can cause delirium in itself.
Dr. George says delirium is a little different for everybody and that most people recover. He adds that we're just starting to learn about the long-term consequences of the condition, and it's important for researchers to study people as they recover.